Hello everyone, Dr. Mandell here with you, and hopefully you're having a beautiful day or night. We are streaming live as notifications are being sent out worldwide. The topic today is a very, very important topic that very few people spend time talking about this, particularly physicians and doctors. This is going to be an interesting program. I've really never operated this way, particularly with this program, but I'm going to give it a shot because I always wanted to take the time out and explain the important things to people out there in the world on how to understand your own x-rays. Now, many of you have seen your x-rays, may even have your x-rays at home or have pictures in your computer or on your tablet. But I want to review some very important things about the neck. Many of you know that I have specialized with many neck problems because of the fact that I have experienced these in the past. And I just dug deep as you ever can go. And that's why I am fairly knowledgeable when it comes to these conditions. Let's go ahead and head right for the x-rays. I will be using a cursor, a pointer, so I'm going to be able to point out, hopefully, if this system lets me do it. But let's give it a shot, and hopefully you will enjoy this program. I really think that this is going to make a huge change. I'll try to move through it as quick as I can. Let's go ahead and let's go for the nuts and bolts here. All right, here we go. You're not going to see me. I'm going to disappear from you. So we're going to only see x-rays, but I will point it out and explain a very important thing. Let's go to video capture here. As I go ahead, I'm going to be zooming each picture in as we take one picture at a time. Right now, it seems like we're doing good. This is before a crash, after a crash, and this just shows us the differences of what they call a military neck. Now, many millions of people worldwide have this military neck because of the forward head posture, bad posture, looking down, sleeping incorrectly, etc. But this shows right here, where I'm moving the cursor, it shows a straightening of the normal curve, and it shows here a reversal of the normal curve, okay? Now, we're going to go into this because this particular right here pre-crash, before the crash, this curve was never perfectly normal in the first place, and then obviously the whiplash stretched these ligaments over here, causing this reversal. Now, just to give you a little understanding, I'm going to repeat this several times. This is the first cervical vertebrae called the atlas. Here is the second vertebrae called the axis. Here is C3, C4, C5, C6, C7. So you have 7 cervical vertebrae of 8 cervical nerves. The first nerve stems out right here, and you actually have 8 cervical nerves. But let's not talk about the nerves. Let's talk about the osseous hard tissue that shows an x-ray. These are the disc spaces right between here. This is where the spinal cord runs through, which you don't see here because that is soft tissue, and it's inside the back here. This is the spinous processes, okay, these little things that fan out here. And that's really what I want you to know on this picture right here. Let's move on to the next picture. Here shows degeneration. Now, this is a big topic. Degenerative joint disease, degeneration. As you see here, these are bone spurs as a result of the curve that's staying straight. This curve should be more C-shaped. You see my arrow right here? More C-shaped. Like this, and actually I'll explain more as we progress. But these are spurs from improper posture, improper weight bearing. Whenever the curve stays straight, this area right in here, if you look what I'm circling, this is the center part of the neck, and the weight of the head kind of compresses downwards, degenerating the discs. Now, we cannot see the actual disc in itself. We can only see the thickness of the disc, but when you see discs this thin, where that black is right here, when you see how thin that is, that generally could be herniated, bulging, because we lost a lot of hydration of that disc. But the problem here is that these spurs right here are the front part of the vertebrae. That's good if you're having it here, but when you start getting spurs back here, these are where the nerve roots come out of. These are the nerve roots. You see right in here, the nerve root would come out of here, the nerve root would come out of here, here, and as these vertebrae get closer together, the nerve root becomes more compressed. And it's very important you understand that. These are called the facet joints. These are where the bones sit on each other, right back here, little spaces right back in here. But these are where the nerves are coming out of, and I'll explain more as we progress here. Let's move on to our next one. Here is cervical radiculopathy. Many people who have conditions within the neck area, those nerves will actually just travel right inside the shoulder blade. It will travel inside, down the arm, into the hand, the fingers, numbness, tingling, burning. This can go into the chest. Just to give you a little understanding that this is the brachial plexus of where those nerves go to. This shows you another brachial plexus, how the nerves come out, where they go to. We have thoracic outlet syndrome that can happen from the scalenus muscles here, from the first rib, as well as the pectoralis minor, right about in this area. But in this situation, if you have compression or irritation of these nerves, you can feel pain anywhere along this nerve down to the fingers, tingling, numbness, burning, cramping, just so you have an understanding on that. Here, we're looking at a lot of degeneration. This is a significant picture of degeneration. You can see all this degeneration here, all these spurs, all this calcification being put in here. If you look here, right on the outside of the vertebrae, kind of looks like the inside is like real radiolucent, or what we call, you can see through it. The outside kind of looks like a picture frame. This is definitely osteoporotic. We call it osteopenia. When you have osteopenia or osteoporosis, those bones, particularly right here, can compress. This kind of looks like a compression fracture. See how it's compressed when you compare this area here compared to this. It may not be a true compression, but a pathological compression as a result of weakness, of lack of calcium of the bone matrix. As a result of that, back in here, okay, that where that nerve is coming out of, that nerve is definitely going to be irritated, and that's going to cause a lot of pain and symptomatology. So let's move on to the next one here. This is a picture here that shows us the nerve roots. The reason why I wanted to show you this, if you look here, these are the facet joints. See these areas right here? These facet joints right here is where the bones sit on. But from Facet syndrome, very common when you get inflammation or sclerosis, which is like calcium that is laid down to that area, and that periosteum of this area of the facet joints is very, very pain sensitive. And those facet joints in those areas, for example, here's 1, 2, 3, 4. So let's say the fourth nerve root, I'm just give an example here. This area right here, or the fourth vertebrae, just to show you, that can affect pain in different areas. The fifth vertebrae can, that nerve root can refer pain. So when you get facet problems and you have pain down into the shoulder blade area or down into a different area here below the shoulders, we'll notice that you can have referred pain just from Facet syndrome versus nerve roots, and that can be quite complex. Let's look at this picture here. This shows a healthy disc area, a degenerative disc. You can see degeneration happening on the vertebrae here. As that disc gets smaller, the hole called the IVF right in here, called the intervertebral foramen, and that nerve that comes out becomes more impinged and irritated. And obviously the key thing is getting that impingement out, preventing that from degenerating. But a lot of forward head posture, alteration of that normal curve is going to cause this quicker degeneration. This can lead to bulging disc as well as herniated discs. As we come over here, we're looking at thinning of the disc. We're looking at degenerative disc. You can see the difference of the disc above and below. Again, this vertebrae looks pretty good. C1, C2, C3, C4, C5, between C5, C6, generally affecting the sixth cervical nerve root here. That nerve can affect into the first and second finger, causing weakness into the grip strength as well. This is important. If you look here, see this little picture frame appearance out here, the picture frame appearance on the outside, and it's kind of like not as white and dense on the inside. That's osteopenia. And you're looking for potential problems here. This can be a form of osteoporosis as well. Let's move on just to blow it up a little bit so you can see it. Here again, we're looking at thinness of the disc between C4 and C5. We have good cortex, nice and white, nice and dense. Again, you see the straightening of the curve. Now, if you look behind the vertebrae here, and I'm drawing like an imaginary line with that cursor, you see how it stair steps. See the back of C4 and the back of C5. You see how it's not even. If I draw an imaginary line back behind these vertebrae, this should run smoothly. In between the 4 and 5, you have a little bit of a dip of posteriority. See from here to here. See it's not smoothly. That's a potential subluxation or compression of that nerve root, which can affect that C5 nerve root, and that can cause significant pain and compression as well. But the vertebrae look good, but you see how straight the curve is? That is an alteration normal cervical curve or a military neck. This will give you a better example. This is what I wanted to come to, because a lot of people are asking about their own spine. Their doctor says, well, I have a reversal or straightening of the neck. This is abnormal. This is normal. Now, you see the normal C-shaped curve? The C-shaped curve should go inwards. You see it? Should go inwards. And see how nice these discs are? Comparing it one to the other. It's beautiful spine. When you have that normal curve, you don't show a lot of degeneration. But when this curve is reversed, that curve actually gets longer. I'll have to show you in person when I come back. But this is a big problem because this can actually lead to a lot of problems down the road. As you look here, just moving up here, this just shows you headaches. When these nerves are being compressed, the nerves affect the muscles. Misalignment of the vertebrae can affect nerves that go over the head behind the eyes, can cause migraines, reduce blood flow. You can come back and look at this later. Here is a picture here of the facet joints. We got sclerosis. We got irritation of these nerve roots. These facet joints can send referred pain. This is degeneration going on. This is an A to P view, a front view rather than a side view, just showing you the sclerosis or degeneration or arthritic change that's taking place in that area. Here's another picture. This picture looks pretty good. Just want to give you an idea of the normal C-shaped curve. This spaces look good. These are the facet joints. You notice you don't see a lot of whitening on here. That looks pretty good. But when there's a lot of degeneration, it becomes really white and obliterated where it's not clear. It's really hazy or fuzzy. This picture here shows us a good curve again. And you notice I'm showing you a lot of good curves because I want you to understand what a good curve is. The curve always goes forward towards the chin. If you see here, here's the chin. Here is no curve. You start developing a little spurring in there, degeneration. And as this becomes more advanced, you notice the head's going forward here. Well, look at all this degeneration here. You see how the discs are starting to close in? Let me bring it up a little more for you. See if I can really stretch that open for you. Okay, but you see here, look how that disc, look here, and look how it's degenerating. You really need to see this kind of stuff because this will cause lots of problems. Remember, we're looking at the disc spaces here. The nerves come out right behind the vertebrae, the body of the vertebrae. These are the bodies of the vertebrae. These are the facet joints where the vertebrae sit on back here, and these are the spinous processes. Spinous processes really have no function, but this is the big problem from forward head posture. Look how the head's forward. Okay, and I'm going to show you that in a model in just a second. We're moving along real good. We're almost done. Here is a radiological examination. This is just some anatomy from the front view, give you a little understanding. The first rib, usually when you look at this from the front, these are the transverse processes. When the transverse processes go upwards, superior, that's usually the T1, the first thoracic. When the last transverse process goes down, comes down, those are the cervical. You can look at some anatomy on that later. I don't want to spend much time on that. Here's another side view, and I want you to understand this is important. Just giving you a little bit of anatomy, the vertebrae, something you should really go back and study. I think this is really good information. Showing you the vertebrae, showing you the pedicles, showing you the articular facets, which are the facet joints, spinous processes, the back of the occiput, a little bit about the anatomy, something that is really important. Come back to that on your own. And I believe this is our last one here. This is a front view. And we're looking at the atlas. In my videos, I have really good videos on atlases. The atlas axis, adjusting the atlas, self-adjusting. This is the most important area. The brainstem comes down to this area here. But this is the odontoid process. The axis is second vertebrae. The side view generally of the vertebrae are going to be more understanding to you than the front view. We generally take A to P open mouth when people are involved in actions to make sure that there's no fracture of the dens or no fracture of the atlas. Okay, so you can come back to that as well. So just some really good anatomy and basis. You should really have a better understanding. Let's go ahead and take us off here. Hello, everyone. Let me go ahead and just show you the important thing here, where before we end up, we talk about the normal C-shaped curve. Now you see that normal curve, that C-shaped curve that we're talking about here. Look at that normal curve, and you can look at the disc spaces between. You can see the nerve roots come out between the vertebrae, called the IVS space, right up in here. But the point I want to get you to understand is that if we're in a forward head posture, there's a military neck right here. If we're in a forward head posture like this, looking down, you can see the stresses that are taking place. You can see the weight bearing of the head being compressed on the discs. The purpose of having a normal curve on here in your neck is so that the weight of the head being 12 pounds can be equally distributed upon these facet joints. These facet joints back here, these facet joints, this is where you want the weight of the head to be compressed. So when it's straightened, the weight's being compressed on the discs between the vertebrae, and then eventually as you go forward, it even gets worse. Okay, so that's why it's important that we talk about forward head posture and correcting forward head posture, because that is where most all degeneration occurs. I really hope that you enjoyed this. This is the first of the first that I've ever done this particular presentation. It did come out good. I'm quite happy. I ask you to subscribe to my channel if you haven't. Check out my channel. Great self-help videos, many when it comes to musculoskeletal elements, neck, back, shoulder, knees, as well as check out my Facebook motivational doc as well there. I appreciate some good likes if you don't mind. But most important, I really ask you to share these videos. You don't have to ask me. Just share them. Leave your comments below. You'll have thousands of people that will read your comments, respond. And this is all about educating the world, because there are so many people who have these particular conditions. I really hope that this helped you in understanding more about your x-rays. Yes, doctors don't spend the time educating, and I really believe that you need to know as much as those doctors know. This is your body, because this is something that you're walking around with and something you're trying to treat. So I hope that this helps you understand when you look at your x-ray, to give you a better understanding for your own self and your loved ones. I want to say blessings out there to everyone out there. I wish everyone out there lots of good health, and we'll catch up with you real soon. Bye-bye now.